Hi, this is Dr.RUkmani Choudhary and you are watching Dr.RUkmani's Health. My today's topic is cervicitis. In this video, I'll be talking all about cervicitis. Cervicitis means cervix inflammation. So I'll be covering everything like what is cervicitis, causes, signs or symptoms, diagnosis, basic test required, prevention, how you can prevent this problem. Homeopathic medicines, I'll be talking about some allopathic mode of treatment. I'll be talking about. You are requested to watch complete video for complete information. Watching on YouTube, you can find all the medicines link on the description box, but you are requested to use one medicine at a time depending on symptom similarity is the basic principle of homeopathy. So the definition, what is cervicitis? See, cervix is the opening of the uterus, means the baby womb, we call it. So cervix is the opening of the uterus, and if there is any kind of infection, inflammation or any size increment of the cervix, then we call it cervix inflammation or cervicitis. What are the causes for it and how it develops? See, if we talk about the causes, cervicitis is a common problem and it doesn't have any symptoms, means most of the time it is asymptomatic. So moving on the causes part, serious cause is infection. If you are having any sort of infection, let's talk about STDs or STIs, sexually transmitted disease or infection like gonorrhea, chlamydia, genital herpes. So these are the infectious disease if you like your partner having STDs and you are having a relation, then you can catch this infection from your partner. So these are the blamed most serious one and common one infection. So if in these cases, yes, you can develop cervicitis. Next is chemical irritant. See, if you are allergic to any chemical and you are overusing, suppose you are having hygiene product, you are using feminine hygiene product for cleanliness, of course it is required, but overusing it and you are allergic to it, so this can irritate, develop, and eventually you can develop cervicitis. So again, chemical are also blamed for the cervicitis. At times, cancer, if you are having pelvic organ cancer and you are going for even cancer treatment, so cancer and cancer treatment are also blamed for the cervicitis. Hormonal imbalance, if you are having hormonal related issues, means estrogen deficient, then you can develop cervicitis. Allergy is also blamed, that you can have allergy for some product, some protection product, like if you are using any spermicidal jellies, if you are using diaphragm or any other product for for the protection, so you can have allergy from them and you can develop cervicitis by using them. Sign or symptoms completely on the type and the cause of your infection. The treatment again depend on your cause and sign or symptoms in homeopathy particularly. And we already informed you that cervicitis asymptomatic, means you don't have any symptom. You go for your routine examination for routine ultrasound, and then you got it not that you are having this problem by the USG or some other test. So the case can be asymptomatic. You can have abnormal vaginal bleeding, you can have grayish thick thin discharge, you can have lower backache, you can have at times, if you're having infection, your cervicitis is due to some infection, then you can have there can be periods in between periods, means you can have bleeding in between your periods. This symptoms again very common. You can have the symptoms, you can have bleeding after your relation, you can have bleeding, you can have dyspareunia, painful relation pain. Symptoms again can vary from patient to patient. And on the diagnosis part or the test cervicitis. See, cervicitis is diagnosed by the USG and all. So basic tests are your blood tests. You done all your blood tests, your basic parameters, and you can go for USG, you can go for TVS, transvaginal sonography, and there is a test called pap smear test. Some vaginal fluid is taken out and studied for the type of infection, what type of infection you are having, and if there is an infection is found, so for the further evaluation, for the advanced test, go for biopsy, like tissue sample are collected and they are studied for further if you are having any abnormality in your pap smear. So tissue biopsy part, prevention, and how you can avoid easily by following some easy habits the first thing that in causes we discussed that if you're allergic to some products, so just avoid using that. And if you're using any chemical hygiene product or you are having problem with that, so you can cut down and you can discontinue it eventually. And if you are you having any sort of infection, so just avoid having relations, so you cannot transfer this infection to other persons, so just of course limit your partners. So these are the basic follow, and you can avoid this infection transmitting to others and getting the treatment or top effective homeopathic medicine for cervicitis. See, in homeopathy the most important thing is your symptoms. Any of you can have cervicitis, but what matters is your symptoms. In homeopathy, symptom similarity with the medicine. Alumina is the medicine in homeopathy that is very effective. You are having cervicitis with constipation and your problems are relieved by cold application. In that case, you can use alumina. In alumina, you have severe burning, severe itching. So you can start with the lower potency, 30 or 200. This is the potency, and you can use with the help of dropper 2 to 3 drops twice or thrice before meal, and minimum 2 to 3 weeks. Kiriozot. Kiriozot is the medicine you might have heard about. The Kiriozot in homeopathy is given for the offensive discharges anywhere from your body. If you're having offensive, smelly, putrid, discharges, in that case you can use Kiriozot. Kiriozot in 30 or 200 potency, 2 to 3 drops, again with the help of dropper, direct on tongue. If you have any problem while having medicine directly, you can add some water and you can increase the number of drops of the medicine. So Netramur. See, Netramur again in cervicitis. Netramur is given when you have thick discharges and your problem are aggravated during night. You have itching during night. In that case, you can use Netramur in 30 or 200 potency, or 2 to 3 drops with the help of dropper twice or thrice till the time you start. Next medicine is Sabina. See, in symptoms we discussed that you have periods in between your periods, means you have intermenstrual bleeding. So in that case, you can use Sabina, very good medicine when you have bleeding issues. So Sabina can be used again with the help of dropper, 2 to 3 drops twice or thrice before meal. If your case is severe, you can use medicine multiple times, like 5 or 6 times. If your case is mild, you can use medicine 2 or 3 times. Depends on case severity and case. Now we are having sepia. Sepia is the medicine that tops the chart for all female health issues, for cervicitis as well. So sepia is the medicine when you have cervicitis with PID infection, means your infection is so severe that your all pelvic organs are affected, means you're having PID, pelvic inflammatory disease. In that case, you can use sepia in 30 or 200 potency, again with the help of dropper, 2 to 3 drops twice or thrice before meal regularly till the time you get improved. There are other medicine as well, like Maxol and Pulsatilla. There are so many medicine depending on your symptoms. So hopefully these video can help you. If you finding these video knowledgeable, informative, please like and share. If you are new on channel, please subscribe the channel and press the bell icon to get notified. And I have put end screen on the videos and you can press on them further and detailed information. Thank you for watching. Thank you so much.